From its beginnings in 1970, the vision of Rogue Community College has always been to inspire, strengthen, and transform the lives of the people and the economy of the region. When the college recognized the demand for more healthcare workers to meet the needs of the community, the RCC vision guided the Board of Education and leadership to a dream: bring all the healthcare programs to one shining new building, equipped with the latest instructional tools, a place where faculty and students collaborate across programs.
And the school is looking for $20 million to put towards improving, expanding, and renovating.
This dream was made possible by the voters of Jackson and Josephine counties, who passed a $20 million bond in 2016, and donations from dozens of generous supporters from around the region. In March 2019, RCC leadership, government officials, and healthcare partners broke ground on the new building. Local residents would get the best in education to earn degrees and certificates to good-paying jobs in the Rogue Valley. Designed by Henneberry Eddy Architects and Kistler and Small and White, and built by Adroit Construction, the Health Professions Center would be home to the RCC nursing degree program, as well as licensed practical nursing, basic healthcare certification, dental assisting, medical administrative assisting, medical assisting, pharmacy technician, phlebotomy, and sterile processing technician. The project stayed ahead of schedule and was finished in August 2020. During construction, dozens of supporters from healthcare and the community came forward and donated over $850,000 to equip the new center. And on October 8, 2020, we finally cut the ribbon.
Today we're celebrating the grand opening of the Health Professions Center at the Table Rock campus. I would just like to thank the voters of Josephine and Jackson counties for supporting the 2016 bond that allowed us to do construction of new buildings and renovations of existing buildings throughout our district. This facility is housing a multitude of health professions programs, including nursing, practical nursing, and other programs. But most importantly, it is a place where students can begin a career pathway. One of the reasons that we co-located all of the programs in a single place is because the trajectory of students in nursing programs usually starts with an allied health program. So by co-locating all of them together, our students can work together. They can see and meet other faculty and really see what the potential for their healthcare career trajectory can be. Our faculty made up a term they call cross-mogenation, and this building was designed to create cross-mogenation. And what that means is that our students are going to be able to develop their healthcare mojo in a facility that allows them to sort of cross-pollinate with other healthcare programs and see what the possibilities are for their future career paths. So we're excited to share what cross-mogenation really looks like in a physical space, and thanks to our faculty for embracing that concept and showing how different healthcare career pathways can actually work together to achieve a really high level of healthcare training.
The voters put their trust in RCC, and the college answered by reaching out to the community and applying for state grants to raise additional funds for the project, and they stayed on schedule.
With careful management during the bond execution process and in obtaining state grants and additional matching funds, they were able to nearly double the amount of revenue funds available for capital improvements within the district, $38 million, to improve our structures and our ability to deliver content to our students. The Health Professions Center that we're opening today is one of the new facilities in our district that are a result of that bond initiative. We should also recognize as we open this today that it's been completed on time and under budget, which is not something that usually happens within what we hear often in public projects. We're also thankful for the work of the RCC Foundation. Through their efforts, they've raised $850,000 of donations and equipment grants to help staff and to help equip the facility so that we can deliver state-of-the-art training to our students. And this level of support is really unprecedented within the state and really speaks to the level of local donor and business commitments and confidence in the college.
Welcome to the Nursing Skills Lab here in the brand new Health Professions Center for RCC. I'm Jenny Shirley, lead instructor for the Nursing Skills Lab. I and the rest of the nursing faculty have been working on the plans for this building for years. We're so excited it's finally here. This brand new lab, which is state-of-the-art and more than double the size of our previous lab, is going to allow us to train more nurses to help meet the needs here in our community in Southern Oregon.
It means a whole lot for everyone in this county. We badly need jobs. The healthcare profession has been needing staff for years and years and years. The tremendous opportunity we have to provide those jobs, it's a great investment in our future.
Hi, my name is Valerie Barr, president of the RCC Foundation. On behalf of the foundation, we'd like to thank our donors who generously contributed to the building and equipment of the beautiful, beautiful new Health Professions Center. Students will be trained on modern equipment to become the much needed professionals for the community. Partnerships work.
This building is really a sign of hope for our community during the COVID-19 pandemic. It is a sign that we are going to be able to respond by creating trained healthcare workers to meet the needs of our community. We are so excited to unveil this facility to our constituents who supported this bond, and we look forward to a day when you'll actually be able to come on site and see it face to face. Thanks for joining us. We are so happy to have you helping us celebrate the grand opening of the Health Professions Center at Rogue Community College's Table Rock campus out in White City. We are live there at the campus, and we want to take you on a quick walkthrough to show you some of the things that we've added since the drone footage was shot that you just viewed. So let's take a walk.
Hello, right this way. First place we're going to take a look is in our nursing labs or teaching area, right this way. And we have Jenny, Rhonda here, sorry. Rhonda here is going to help us.
Hello, this is our Nursing Skills Lab area. The students are able to practice their skills here in the lab much like they would work in the hospital setting. And in here we have a clean utility area that we've mocked just like they have in the hospitals, so that the students, when they get into the hospital environment, they're able to get in there and really work and see exactly how it works in a real life situation. So.
Would you like to show a look? Right this way.
Oh, thanks, Grant. Welcome.
Okay, right this way. Thank you. That was a nice look at the nursing area. We're now going to take a look at phlebotomy. And Tasha is going to talk to us a little bit about that. And right this way. Hello, Tasha.
Hello there. Welcome to phlebotomy. This is our classroom. Students start on the arms here. They start practicing on the arms the first week or so, and then once they're done practicing on the arms and have the skills, basics part of the skills down, then we move over to our phlebotomy stations, which are all set up just like a real phlebotomy lab. And yeah, we've got everything organized just like you would see in a real setting.
So they're learning in here in an environment that'll be just like when they
just
get
like in a real lab in an outpatient setting.
That's great.
Yes. Yes.
And how many phlebotomy students do you usually have in a year?
Typically we have 15, but with COVID we've cut our class size down to half, so students can stay spread out and practice social distancing. And yes.
But we're still getting people trained and get ready for the workforce.
We're still getting, yes, we have the proper PPE in place. We're doing shields and masks to keep our students safe, and yes, it's very realistic in here for them.
Great, thank you.
Yes, thank you.
Well, let's take a look at downstairs. No, actually not downstairs. We're going to go over to the medical assisting area now. Are we going to take the hallway, or we're going to go on around? Okay. As you can see as we walk along here, we have these beautiful murals that have been put up. These were designed by students, and they are in areas all around the Health Professions Center. Some of our own design students did this work. It's beautiful. And of course, this is our amazing lobby area here upstairs. We've got a beautiful view of Table Rock campus from here.
MA.
That's right. I always want to go this way. Here we are. And the lighting in here is amazing. So now we're going to talk to Jenny in the medical assisting lab. And we'll get a look at that right now. It's right here. Hi, Jenny.
Hi, I'm Jenny Konarski. I'm the medical assistant instructor and coordinator for the program. This is our new lab. So, as you can tell, we now have 8 patient beds set up just like they would be in your standard clinic. This is a huge improvement from what we had before, and it really allows students to immerse themselves into what they will be getting into when they get out into their practicum sites and later into the workforce. We have about 80 students graduate every year, and then they just go out into the valley and are joining our workforce here, so we're very excited to have a space that really accommodates that.
So they're learning here first in this very realistic environment, and then they also do practicums with different healthcare providers around the valley.
Yes, yep, they come in here, they learn the skills, and then they go out into their practicum sites for 2 full terms. And during their practicums, we still allow them to come in and practice any skills that they would like to.
Okay, and what kind of medical, I mean, what does a medical assistant do?
Medical assistants are the assistants to a physician or any doctor inside of an ambulatory clinic. They do a variety of tasks. Everybody's used to seeing them when they introduce themselves and take their weight, vitals, but they do a lot of back office administrative work and also clinical tasks such as taking vital signs, doing procedures, things like that. So they're a very multifaceted profession.
Okay, well, thank you very much.
Yeah, thank you.
Beautiful. Let's take a walk downstairs now. I tried to go downstairs before, now I actually will. This building was finished on schedule, which is something that doesn't always happen, but We had a great construction manager and a great building company, Adroit, really helped us out. So now we're going to take a look downstairs. First, we're going to go this way into the dental assisting lab. Just a moment. Make sure you don't get your feet tangled up there. So, right this way into the dental assisting lab. And I'd like to introduce you to Carmen. Carmen Mon.
Hi, my name is Carmen Mon, as you were just heard. I'm the coordinator of the dental assistant program and full-time faculty for Allied Health. This is our new dental lab. This operatory is kind of set up in what you would see in a regular dental office. We have our computers so that we can take digital radiography, which is much less radiation to the patient, very clear radiographs. And then over here, we have a panoramic, which is also digital, machine that can take a picture of the entire mouth all at one time. Our students they have their own lockers, so each, if you look at the cabinet along the edges, they have a key, they have their own locker, they can keep all of their own personal things separate from each other and have that really, be just their area. We really have everything you would see in a dental office if you came to have a silver filling. We have the machine for that. If you were going to have a tooth colored filling, we have the machine that would set that up. Back in the back, you will see that we have a sterilization lab. In the past, that's been just a separate little area, and now we have a full room, just like a working dental office would have. On the right-hand side, we have a dental materials lab. And what dental materials lab you're able to do is you're able to take impressions of the patient's tooth and pour up a model and make a whitening tray for them. And our expanded functions dental assistants will learn how to and be certified to do those procedures, make temporary crowns, that type of thing. And so all of that will be in here. It's extremely loud when that's happening. So before it had to be out on the counter in clinic. And when that happened, the rest of clinic stopped because you couldn't stand here and talk to each other while we were doing it. So now we can close the door, have something happening here, and still have clinic going on in the main clinic area at the same time.
Well, in a typical year, how many people graduate from the program?
So in a typical year, we accept up to 30 students, but typically we receive somewhere around 25 applicants. Mm-hmm. And we have a pretty much about a 99% rate of keeping students, and so seeing them through graduation, mm-hmm. as well as job placement. That's huge for us because we don't want to just graduate students. We really want our students to hopefully already have a job before they graduate, or at least be lined up with someone to have a job when they graduate. So
that's terrific.
Yes.
Okay.
Yeah, we're very proud of that.
Yeah, now you have this facility, they're even more prepared and more employable.
Very much so. Some of the dentists and dental offices that have donated walk in, and I can't wait to actually show them a little bit more of what it will really look like. They'll know they're ready to walk into an office that looks just like their own. Awesome. and know what to expect.
Great. Well, thank you.
Thank you.
Yeah. Well, let's take a walk now down to sterile processing. You still with us here? Okay. So, the dental assisting lab is, love all the windows in there. What a wonderful learning and working environment. Next we're going to see something a little similar to that, which is Farm Tech right in here. And we have Rhonda again here to help us out with Farm Tech.
Hi there. This is our pharmacy area. Here the students are able to go on the computer here and order up the desired prescription, and then the corresponding cabinet will open and they get their prescriptions out of here. And they also are able to do compounding of prescriptions as well, which is a really neat up and coming thing for the students to learn. So really excited about all this great equipment that we were able to get, and I'm sure the students are really loving it.
Yeah, a lot of that equipment is thanks to the donors, as we mentioned before, $850,000 from local donors to help with all the equipment in this building. And this is the sterile processing area.
Yeah, so the sterile processing area, we really went to our advisory board to find out what does it look like, what do we need. This sink is there's actually 3 sinks in one here so that it can be exactly like they would in a sterile processing area at the hospital or at a smaller like GI clinic, that type of thing. So this would all be considered the dirty area, and then we have this window where we can then process all the clean instruments and place them on the other side of the wall, and that way they would be going through the steps that would be everything you would do in an actual office for sterile processing. And it's just super important for the students to be able to look at it, see it, replicate it. I mean, they even have a dishwasher system that you open up and instruments go in here. Dental has the same thing, a sterilizer. They're using all those instruments that they would use and all those tools they would use out there in the real world.
Fantastic. Okay. Well, right this way, we'll take one more little look out in the hallway here. Again, we have another one of these beautiful murals that our students created. And we conclude today with a message. Fantastic.
Well, I hope you enjoyed this live tour of the Health Professions Center. And again, I want to say thank you to the voters of Josephine and Jackson counties for supporting the construction bond that helped with this effort. And I also want to thank the state of Oregon for their matching funds. And finally, to the local contributors who donated $850,000 to the Road Community College Foundation for the equipment and furniture that make this building a state-of-the-art facility for health professions training. Thanks again for joining us.